If you haven't experienced it, consider yourself very lucky because there's really nothing more annoying than coming home, relaxing, everything's totally silent, and all you can hear is I am Dr. James Munro, and today I'd like to talk about tinnitus. And if you think I pronounced that wrong, that's a perfect place to start. If you say tinnitus, I will know exactly what you're talking about, so ultimately it doesn't really matter how you pronounce it. But I would say that tinnitus is a more accurate pronunciation. The suffix itis, I-T-I-S, refers to inflammation, like sinusitis. That means inflammation of the sinuses. So if you say tinnitus, you're sort of implying that it's an inflammatory condition, and it's not. But like I said, if you pronounce it tinnitus or tinnitus, it doesn't change the fact that it's a really annoying thing to have happen to you. Tinnitus is ringing in the ears, or potentially a whooshing sound in the ears. And there's actually two kinds of tinnitus. One is called subjective, and the other is called objective. The objective type is pretty strange because other people can hear it. Your ears are actually making noises. Usually this has something to do with the microvasculature, the blood vessels around your ear and your eardrums. For this discussion, I'll be focusing on subjective tinnitus, which is the perception of sound. So there's not actually a sound that you're hearing. You're just perceiving a sound. It's important to realize that tinnitus is not itself a disease. It's just a symptom. And it's not always associated with a problem in the ear. It's actually a sensory problem, a problem with the nerves. Sometimes this problem does originate in the ears, but it can also originate elsewhere. So inside our inner ear are these little hairs, and when we hear something, that's a vibration, and that vibration comes into our ear and rattles those little hairs. Those little hairs set off a neuron, and that neuron sends a signal to our brain telling us that we just heard something. These little hairs in our inner ears can get damaged in any number of ways. Infections, loud sounds, it can even just be a part of the normal aging process. And when these hairs are damaged, they don't send the appropriate signals through the neurons. These damaged hairs can accidentally be sending signals through the neurons, which is causing that ringing in the ear, or there can be a complete absence of neuronal signaling, and the brain sort of fills in the gaps, and that causes the ringing in the ears. So if this is the case, things like hearing aids or cochlear implants or even ambient noise machines can help to mitigate the inappropriate neuronal signaling. But also, most of the things that I'm about to talk about will be helpful here too. Another possible cause of tinnitus is something called Meniere's disease, and I very much might actually be pronouncing that one wrong, so I will accept your criticism if I'm not saying that one right. This disease doesn't seem to be completely understood, but it looks like it's caused by a fluid buildup in the inner ear. And this can be caused by an injury, a knock to the head, an infection, an autoimmune condition, any number of things. And it usually goes along with vertigo, which is like extreme dizziness, and progressive hearing loss, which can actually become permanent. Usually this one happens in only one ear and not both ears. Tinnitus can also be associated with low levels of thyroid hormone, so correcting this could also correct the tinnitus. If you want to learn more about how to potentially identify a thyroid issue, check out my other video on thyroid hormones and how we should measure them. Tinnitus can also be associated with nutritional deficiencies or insufficiencies, not quite enough. And a lot of these things can definitely help if there is damage to the little hairs in the ears too. People who experience tinnitus tend to have much lower serum levels of zinc than people who do not experience tinnitus. So this suggests that low levels of zinc might be contributing to tinnitus. There was a similar finding with vitamin B12. Low levels of vitamin B12 could contribute to tinnitus. In another trial, people that had tinnitus as well as low levels of CoQ10 supplemented with CoQ10, and as those levels of the CoQ10 increased, the tinnitus symptoms decreased. So low levels of CoQ10 might be contributing too. Increasing levels of vitamin A was also shown to decrease symptoms of tinnitus. And, my favorite, magnesium was shown to be really helpful here as well. Tinnitus is associated with TMJ disorder, temporomandibular joint disorder. That's your jaw. So an issue with the joint here or the musculature around here can cause that ringing in the ears. Check it out. You can even do it. You just bite down really hard. And I'm doing it. I'm making my ears ring. Magnesium can be really helpful here too because it can relax the muscles and help increase the circulation in the area. And all the other things that help with TMJ issues can help with tinnitus too, like acupuncture, massage, physical therapy, those kinds of things. I've also treated tinnitus patients with supplemental iodine, and this might be helping because of its positive impact on the thyroid. It increases thyroid hormone, but it might also be helping for a completely different mechanism that I'm not aware of. But either way, I have seen it work. Tinnitus is also associated with depression. There have been plenty of cases where people have depression and tinnitus, and their depression is treated either nutritionally, pharmaceutically, whatever the case may be. But as the depression improved, the tinnitus decreased. So this would suggest that appropriately treating depression, however you can, would also help with tinnitus. And I definitely have to make a video on depression. I'll get to that soon. And a couple other things that have been shown to help in cases of tinnitus that I should say right now, otherwise I'm definitely going to forget. Melatonin, ginkgo biloba, and essential fatty acids, omega-3 fatty acids, fish oils. If you've made it this far in the video and you're wondering what the heck you're supposed to try, because I just said 1,000 things, well, that's really the trick. You have to determine the cause of the tinnitus in the first place and then go after that. Because like I said at the beginning of the video, tinnitus is a symptom. It's not a disease itself, so there's not a cure for tinnitus. It's the same way there's no cure for a sneeze. You have to figure out why you're sneezing and then address that. You might be sneezing because you have a viral infection, or you might be sneezing because you just snorted a bunch of black pepper, and the treatment for both of those things is very different. I definitely don't recommend trying any of those things that I just mentioned without having some reason to believe that you need those things. I do recommend working with your doctor to figure out what your body might need and figure out what the heck is causing the ringing in your ears in the first place, because it can be super overwhelming and can really diminish your quality of life. It's definitely worth the time and effort it'll take to figure out what's going on so you can solve the problem. All right, that's all I have for today. If I left something out, or if you have a question about something, leave it in the comments and we can discuss it further. If this video was helpful for you, please click the thumbs up, comment, share the video. All of these things will really help me and help the channel to grow. And if the channel keeps growing, I can continue making more videos for you. If you have a topic you'd like me to discuss, leave that in the comments and maybe I can make a video about it. Thanks so much for watching. I really hope you got something out of this, and I hope you're great, but I hope tomorrow is even better.